Alright guys, we're back. And this time, we're taking a look at that next one. And does anybody remember what we called this one? We called this one our Coags, for our coagulation studies. And we started the discussion about this has to do with the time frames to get your blood to form a clot, okay? And this is another really powerful concept to know and get locked into your mind. Wow. I mean, it can really benefit you. So here we go. Coag studies. Now, if you remember, we were talking about our magic numbers. And in that sequence of magic numbers, 7, we said was a really powerful number. To start this one off, if we double 7, we get our starting number, which will be 14. Now, hang on to that in your mind. Yeah. But if we're talking about coagulation inside your body, what do we hear people talk about the most when it comes to coagulation in your body? In hospital circles, right? In school. What are they saying? PT, I, and R. And there you go. That's how you start that thing off. Ready? PT, then I and R. And your PT is the one that's going to get that 14 we were talking about. But let me show you a very special way to get that right, okay? So we said what? PT and I and R. And now, PT, Prothrombin Time, and then INR, which stands for International Normalized Ratio. Sounds like a mouthful, but we're gonna relate it this way, just to make it sink into your mind a little better, okay? When we say that something is a ratio, we're dividing some number by another number. And then interestingly, the International Normalized Ratio, INR, goes off to the side here, where we got one number on top of another number. And it's what? Pointing to the ratio. One number over another number, INR, okay? So we already gave the PT up here. At the bottom, the PTT, all right? The partial thromboplastin time. Again, that mention of time, second. How long does it take your body to make clots? So, all right, but now, before we pull up the next slide, let me just show you something on the board that hopefully you can see from this distance, okay? So I'm doing PT, and I'm also doing PTT. Now, this is one of those things where I add a little special sauce onto this thing to help you understand. Okay, so now, you remember that number that we said we were assigning the PT? We said it was 14, correct? How do we remind ourselves it's 14? We're going to take the letter T, and we're going to draw this diagonal line and turn that into a 4. And by the way, PTT, its number is going to be, guess what? 44. And what are we going to do? We're going to draw a couple more of those diagonal lines and make that 44. And we can see in there our 14 that this is supposed to be, and our 44 that this one is supposed to be. Now, we're going to be dealing with rough numbers as we're talking about this stuff. Because when it comes to coagulation, age is a factor, sex is a factor, you know, women versus men and things like that. So, you know, we're gonna give ourselves some numbers to keep our sanity, and that's 14 over 44. But now, what number are we gonna use to figure out our low parameter and our high parameter? And we're looking at 4. So, when we're talking about the low end of PT, we're talking about roughly 10. When we're talking about the higher end of PT, we're looking at what? Roughly 18. Okay, and we're going to do the same thing with PTT. 44 minus what? 4 will put us at roughly 40 plus 4. If we're adding 4 to 44, that would put us at 48. Right. That gives us a nice, solid range to deal with our magic numbers, by the way. Great stuff. So anyway, and we don't want to ignore the INR. Let's put that up there. So INR, and what I want you to remember about the INR, we're not going to make a big deal out of it because the INR is so simple. It's as easy as counting to 1, 2, 3, right? Counting to 3. Super easy. Now, what do we just say? 1 to 3? So the INR in the person, a healthy person, should be less than 1. But if they're under therapy, it should range between 2 and 3. Now let's pause. As we start talking about therapy, that's if the person's taking Coumadin, right? Or they warfarinized. Everybody understands that Coumadin's other name is warfarin. So are they taking Coumadin and we're trying to reach a therapeutic level with that? Then instead of less than 1, like normal people's therapeutic level, we want their blood nice and thin between 2 and 3. Why would we do that with someone? That would fit with someone who has atrial fibrillation. Somebody who's, right, has a strong tendency to make clots that could be life-threatening. So we need their blood to be nice and thin. So instead of that less than 1 like normal, we want them between 2 and 3. Now, that's speaking to Coumadin. Let's also talk about heparin, right? So in the case of heparin, we also want them between 2 and 3. But now, as we're talking about those 2 medications, we need to look back at what we wrote up here. So initially, we wrote, right? We turned that PT, we turned that letter T into a number 4, right? This time, we're going to do something a little bit different. So let me erase this 14 and this 44 and take it back just a little bit. All right, so we're back to our PT and our PTT. Then the question becomes, right? If we're talking about Coumadin therapy or heparin therapy, which one of these studies are we looking at? In the case of PT and INR, we're looking at Coumadin. But then you wonder to yourself, how do you know that? Why isn't it PTT? But the reason it's not PTT is because you take the 2 letter T's and you cross them going straight across. And what letter does that make? That makes a letter H. A letter H for heparin. Yeah. That's how you do that. So not only do we use it to help us signal in our mind the 44 to capture its range, but we also use those 2 T's and connect them and make the letter H to remind us that PTT goes with heparin. And then what's left goes with Coumadin, the PT-INR, right? Good. So let's look at that slide. All right, boom, our Coags studies. We like to call them Coags for short. Okay, so PT, 14, and we understand that now. And the PTT, 44, right? And the INR, we said typically the INR should be less than 1. But notice that I put the 2 to 3, what? Underneath the word therapy. So if your client's what? Under therapy, then it's going to be 2 to 3. So what's the INR? Should be less than 1, but 2 to 3 under therapy. 1, 2, 3. It's that simple, right? All right. Stay tuned.